Welcome to Constance YouTube. In one of my previous videos, I discussed on the latest paper that reports on the SARS-CoV-2. The COVID-19 virus stay 5 times longer than the influenza A virus on a human skin model. So, the COVID-19 virus may have a higher risk of contact transmission than influenza A virus. Thus, hand hygiene is critical in preventing the spread of the virus. In this video, I will be sharing with you how effective are the alcohol-based hand rub solutions for hand disinfection, recommended by the WHO. Is there any evidence to support for that recommendation? Now, let's go straight to see what kind of ingredients and formulations were tested in the lab to against the COVID-19 virus SARS-CoV-2. This paper was recently published in Emerging Infectious Diseases, testing the effectiveness of 2 WHO formulations and 2 modified hand sanitizer formulations on the COVID-19 virus. The researchers evaluated the effectiveness of different concentrations of these 4 formulations and alcohol and 2-propanol, which is isopropanol or isopropyl alcohol. I will show you the details later. Why there were 2 modified hand sanitizer formulations? It was because the original 2 WHO formulations were found failed to meet the effectiveness requirements of European norm 1500 in previous tests. In response to this finding, Sukhomel and colleagues who were not involved in today's study modified the formulation by adding more ethanol or isopropanol and using less glycerol after finding that glycerol reduced the effectiveness. So, these are the tested formulations. Basically, the glycerol and hydrogen peroxide content for the original formulations are kept the same as 1.45% and 0.125% respectively. And for the modified formulations, the glycerol content is half, which becomes 0.725% for glycerol. Hydrogen peroxide is stayed the same at 0.125%. Take note, the ethanol or 2-propyl alcohol concentration in the original and modified formulation has a different unit. In the original formulation, it is expressed as volume by volume, and in the modified, it is expressed as weight per weight. So the original WHO formulations one consists of 80% volume by volume of ethanol, but in the modified formulation, it consists of 80% weight per weight ethanol. And for the original 2, it contains 75% 2-propanol volume by volume, but in the modified, it contains 75% weight by weight 2-propanol. They also tested the dilutions of commercially available alcohol, such as ethanol and 2-propanol. They are the active ingredients of hand sanitizer on the market, and they were tested in volume by volume dilution. Here is what the researcher did. They tested the virus activity after 30-second exposure of the hand sanitizer using a suspension of 1 part virus and 1 part organic material to load the virus, and 8 parts of disinfectant solution at different concentrations. So this were mixed together, and after 30 seconds, they found that all formulation and dilution of 40% or more kill SARS-CoV-2, and they reduce the COVID-19 virus to background levels within 30 seconds. This is good news for us. Specifically, the 2 WHO formulations had a virus reduction factor of greater than or equal to 3.8, while the modified 1 and 2 formulations had reduction factor of greater than or equal to 5.9. Both ethanol and 2-propanol reduce virus to background levels in 30 seconds at a concentration of greater than or equal to 30% volume by volume, and the reduction factors range from 4.8 to greater than or equal to 5.9. So either ethanol or 2-propanol was effective in killing SARS-CoV-2, the virus that causes COVID-19. The inactivation of the novel coronavirus SARS-CoV-2 was demonstrated for the first time by this researcher, and the authors endorsed the importance of disinfectant-based hand hygiene to reduce SARS-CoV-2 transmission. The authors noted that while 30 seconds is the recommended time to rub hand sanitizers into the skin and was the time used in this study, most people don't use them for that long, they said. The study findings, however, supports the use of WHO sanitizer formulations in healthcare settings during viral outbreaks. I agree that they say that their findings are crucial to minimize viral transmission and maximize virus inactivation in the current SARS-CoV-2 outbreaks. These are the references that I use for my presentations. I hope you find this video educational and helpful. Please share with your family and friends for their benefits and safety. My next video will be on how to get your healthy sprout using DIY sprouting jars. We do need to eat healthily daily, and especially during this tough time. Do you know that the antioxidant contents of mung beans are greatly increased after sprouting? Please subscribe to find out more. Please take care and stay safe. Thanks for watching. Bye.